I feel like I'm the Walking Dead.
Yeah.
I'm like a zombie, only they walk a lot faster than I do. Being active is like breathing air for me. I feel like I'm 80, and after I have my hip, then I can progressively move back into Adele. Because I don't know who this person is.
She's always going, always wanting to go, and always go, 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 go. And then now seeing her never leave the house. And when she does, it's just really, really hard for her.
I came up here on my bike. I went over the handlebars. I thought my life was over. Then I heard about hip replacement, and I thought, oh my God, I could actually have my life back. I'm gonna be able to live again.
Yeah.
I miss that a lot. I miss living.
Adele has arthritis of the hip. She's lost all the cartilage. I can feel it clunking.
Yeah, like clunk, clunk, clunk. It clunks, and that I feel that.
Ooh, that gives me the heebie-jeebies. When she had that trauma and she just fractured that femoral head. It's no longer a round ball and a round socket. Now you have a square peg trying to articulate in a round hole. We're gonna cut the ball off that you saw in that x-ray. And then down there we put a spike basically, and we prepare the bone so it'll fit exactly, and then that's your new hip. So instead of going crunch, 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 it should be nice and quiet and everybody won't hear you coming. What you're gonna realize is the pain that you've had is gonna be gone.
Adele will come to Total Joint Clinic today. She will be able to meet her physical therapist, orthopedic specialist, dietitian, and pharmacist.
I'm feeling for when it starts getting tight.
We're hoping that we can empower her with the knowledge, teaching her how to manage her pain and what to anticipate with therapy.
Pushing a vacuum cleaner. Darn, I can't push a vacuum cleaner. How much you live with your walking? All the time. I'm a limper. What's interesting about pain, it kind of takes over your mind as well as your body. This is when I lift it, it pushes the bone back to bone on bone, and it rubs.
There you go.
My kids all called me last night, and that's when I started crying. And then it becomes real, and you get a little scared.
How are you feeling this morning?
Oh, I'm hopeful.
Every day it's been hurting more and more and you do less and less. But now after you get the surgery, every day I'll start feeling better. Each day is something to look forward to.
This is a table specially designed for hip replacements. The table is basically like a surgical instrument. By tomorrow, she'll be feeling almost like a new person. That's the beauty of a total hip. You're making people's lives better. Leg up. Rotation. So we're entering the hip joint now. Her hip is really inflamed, which is why she was in so much pain. So I'm watching this as I go on the screen so we get it right where we want it. Feels solid, sounded solid, looks solid. X-ray in. I have an X-ray of her hip that we're doing and an X-ray of her normal hip. And I'm overlapping them and getting them in a position where I can tell if I need to make it longer or shorter. That looks great. It's exactly the size we want. We're done. Surgery went great.
I'm so excited.
We'll get her up today and then we'll move around.
I'm so excited. I got to call her kids. I got to call my girls. I'm so excited. So I'm so neat.
Nicely done. Oh, good. I want you to put a little bit of weight shift on that left leg. And your weight bearing, you can walk. You just took a step. You are up and walking the day of the total hip surgery. Very nicely done.
Titanium, ceramic, it's all good. I'm half of a bionic woman. The door of life is open to me. The fact that I walk now and I'm not in pain is beyond words. It's beyond words. It really is. I can dance. I can dance through the day. I can dance through the night. I'll walk down this boardwalk.